Hello and welcome to the Telegraph Studios, where I'm talking to Dr. Wolfgang Seidel of Mercer Marsh Benefits. Wolfgang, we hear a lot about health issues at the moment. The NHS is rarely out of the news. But what are the big impacts of health problems on the country as we speak?
The big impact on organizations that I work with is that health issues cause a loss of productivity. And discussion about productivity in the UK is all over the media right now.
Can we get back to the health though? Give me some specific examples of what's going on.
Yes, most of the health issues that are associated with that problem are connected to an aging workforce and also to lifestyle choices that we are making. And those in turn lead to an increase of non-communicable chronic diseases. What I mean by that is diseases like cardiovascular disease that are very well known, but also diabetes, it's also cancer, and it's chronic respiratory diseases. In addition to that, what we also find is that we are facing an epidemic of mental health issues and stress as well. And on top of that, as everybody knows who analyzes data in the workplace, many people complain about musculoskeletal conditions, that's back, neck and limb pain. And again, those are associated with lifestyle choices we make, but also to a degree with the setup of the modern workplace.
So what more figures have you got? What stands out?
What stands out is that, for instance, in terms of mental health, as I mentioned to you before, we have 1 in 3 to 1 in 4 employees during their working lives suffering from mental distress. And half of those have symptoms that warrant a mental health diagnosis, for instance. That mental health diagnosis would mainly be depression or anxiety disorder. That's a huge problem. According to the World Health Organization, depression is the leading cause of long-term disability in the world. 350 million people are suffering from depression worldwide. Translated into Europe, that means it's 30 million people suffering from depression and costing the European economy as much as 92 billion euros.
92 billion, that's a lot. What does this mean for the economy and for the UK in general?
If we take it a bit wider and look at the economy as you are suggesting, it means that organizations are paying 8% of payroll, quite a significant amount of money, purely on healthcare. And beyond that, if we cast the net even wider and look at the reports that are coming out from the World Economic Forum, they are arguing that the 3 biggest inhibitors to economic growth are indeed associated with those non-communicable chronic diseases associated with changing demographics, and last but not least, also associated with a shortage in skilled employees. So on the one hand, we have people who are unemployed. On the other hand, 40% of employers worldwide are complaining that they can't fill certain positions due to a lack of skills.
So what happens if companies don't engage with health?
Yeah, may I just turn this around and turn it into a positive and say to you, actually, if organizations do engage with health, it's a win-win. And why is it a win-win? Because you have employees who would be improving their status of health and ultimately more likely to achieve their career aspirations. And at the same time, it benefits organizations by increasing their top line and bottom line growth as well at the same time. So individuals reach their potential by engaging in health activities. And ultimately, you know, there's a lot of lip service being paid to your workforce being your biggest asset. But here it really comes to the fore, because when you look at health and engagement and productivity, you really find that those are associated. So I like to employ a rather pseudo-mathematical formula of saying health plus engagement equals productivity.
Sounds good. So are you optimistic for the employee going forward? I mean, what are the encouraging trends you've seen?
Yes, despite some of the bleak statistics that I have given you, I am actually generally optimistic because it's in my nature, but also because I have evidence for that. And the evidence is that more and more organizations are coming to see me asking for a health and well-being strategy since the beginning of 2015 particularly, I would say. And those organizations are now building health and well-being strategies that are built on data and insights and not just on anecdotal evidence. That's why we have helped them by building a dashboard that brings all the disparate data sets into one place. We are looking at data from private medical insurance, data from group income protection insurance, we look at absence data, we look at data from employee assistance program, occupational health data, and all that creates a rounded picture of a status of health of your workforce that allows us to then deploy a really data and insights driven strategy. And I find that some organizations are going even a step further by including a reflection on the relationship between health and diversity and inclusion and the segmentation of their employees and how they can meet that, the diverse needs of their workforce also from a health point of view. And at the same time, they are moving forward some of those companies and are looking at preventative measures, and that's crucially important. Most of UK PLC spend 90% of their healthcare money on reactive healthcare and hardly enough on proactive. So it's time that we become more proactive, for instance, by creating resilience programs, clinical pathways, health pathways, and going a step further in terms of helping people flourish in the workplace, because ultimately what it's all about in the workplace and outside the workplace is to help people reach their potential. And I think Freud put it more succinctly than anybody else by saying the goal is overall to be able to work and to be able to love.
It's always good to finish on a few words from Freud. Dr. Wolfgang Seidel, many thanks.
Thank you very much indeed.